Hello everyone. Today we'll be talking about instruments that are used in our orthopedics department. So in UCMS, these are the different instruments that are used. And today I'll be talking about all the instruments which are actually used, and this is going to be very, very important for your practical examination. So the first instrument, which is of different colors that I'm picking up now, is the titanium elastic nailing system. So these actually are made up of titanium. So we have two important structures which are actually made. One is the titanium and other one is the stainless steels. The popularity of titanium has increased so far because it is very less corrosive, and it's very compatible to be used. But whenever we talk about stainless steels are actually very, very corrosive, and they actually make a layer of chromium over themselves, and that make them corrosive. So there are different types of nailing system. That is the first generation nail, second generation nail, and the third generation nail. The first generation nail, it acts as a splint. The second generation nail, it gives rotational stability, and the third generation nail are actually known as gamma nails. Okay, so these nails have gained the popularity because actually nail becomes a load sharing device, and plate becomes a load bearing device. So whenever we use a plate, it tends to interfere with the hematoma formation, and the nail, it doesn't interrupt with the hematoma formation. In the coming videos, we'll be talking about Hartog's nailing system, and we will also be talking about intermedullary interlocking nail. And the Hartog's is actually an angle which is actually made by the tibial nail. So this is titanium elastic nailing system. So let me talk about some more features of the titanium elastic nailing system. See, we can't use this titanium elastic nail in an obese or in some pediatric patients who have an interarticular fracture. And these tens, that is titanium elastic nailing system, they work under 6-point fixation. Rather, other nails, they work under a 3-point fixation. So that is important for us to understand. Different kind of pediatric fractures are very, very common, like supracondylar fractures. They are very, very common because these areas of the supracondyle, the alignment of the bone changes, right? That's why supracondylar fractures is the most important fractures in the pediatric population. And remember, whenever we talk about supracondylar fracture, the most common nerve injured is the anterior interosseous nerve. Now the wire in front of me is actually a K wire. See, it's very difficult to differentiate between a K wire, a Steinman's pin, and a Denham pin. Okay, so this K wire is very, very thin, and it's longitudinal with no any serrations. Okay, so if you don't see any kind of serrations, then that is actually known as your K wire. Okay, but if you are able to see some serrations at the end. Okay, so in this picture, this is actually a Steinman's pin. Okay, this is actually a Steinman's pin. Now this Steinman's pin is actually used in bone traction. Okay, the Steinman's pin is actually used in bone traction. Okay, and whenever we talk about these, one is Steinman's pin, other one is K wire, other one is Sand's pin, and other one is your Denham's pin. Okay, so Denham's pin, it has corrugations in the middle. Denham's pin, they have corrugations in the middle. But whenever we talk about these Steinman's pin, the Steinman's pin will have certain type of corrugations at the end. So you can see the topmost area, which consists of a quadrangular like structure, like a straight structure. And if you look into the distal area of the same instrument, if you look into the distal area, you'll see some over here. You can see that there's just a pointed area. Okay, so if it's just a pointed area, this is your Steinman's pin. Okay, and once again, I would like to say you Steinman's pin is used in bone traction. And I would like to take this opportunity to tell you that tractions are very, very important in orthopedics examination. Traction, there are bone traction and skeleton traction. Okay, so bone traction and skin traction. So skin traction is given, and the force is transmitted by the skin, subcutaneous tissue, then your hypodermis, and then it comes to your bone. Okay, so that in that way traction is given. So traction is actually a method by which you tend to reduce the fracture, and you stabilize the fracture which is reduced in the same position. Okay, and that is done by Steinman's pin. Okay, that is done by Steinman's pin. So it's very, very confusing. Okay, Sand's pin, Steinman's pin, Denham pin, and the next one is your K wire. Okay, these four, actually, we often get confused between these four instruments. So whenever it's given sans pin, you need to remember that the thread is at the end. Okay, and if the thread is at the middle, that is your Denham's pin. Thread at the middle, it is Denham's pin. Okay, so I'm continuously picking the same instrument, which is Steinman's pin, which is used for bone traction. I already told you there are two types of traction. One is skin traction, or one is bone traction. And traction is the procedure, traction is the method by which we are reducing a fracture. Okay, and what are the different types of traction method used? It's a very, very common question. And what are the different precautions that we take before, like when a person is in traction, what are the different precautions that should be taken? Okay, that are oftenly asked questions. Okay, so in this picture, again I will say you, if the strips are at the middle, it is Denham's pin. And remember, Denham's pin is actually used in osteoporotic bone. It's used in osteoporotic bone. Okay, so, and whenever you utter the word osteoporotic bone, the next question comes to you, that what is osteoporosis? What is DEXA scan? Okay, so that must be very much clear to you. And remember, in osteoporosis, all the markers, that is basically calcium, ALP, that becomes normal. So you can see that, okay, first, second, third. So second and third, basically this both pin, second and third pin is actually the sans pin. Okay, these are actually sans pin. Okay, so this sans pin is actually used for external fixator. So what is an external fixator? The next question is, what is external fixator? What is the Gosler-Anderson's classification? Okay, so we often get confused between K wire. So that the first one is K wire. The second and third one is actually known as the sans pin, which has thread at the last. And if it's not threaded, and if the upper end, see now which instrument that I'm touching, which has corrugations at the middle, this is your Denham's pin. This is your Denham's pin. Okay, and that Denham's pin is actually used in osteoporotic bone or cancellous bone. Okay, it's used in osteoporotic bone or cancellous bone. For example, in someone having a metaphyseal fracture. So metaphyseal is an area of cancellous bone, right? So in that area, we can use Denham's pin. Okay, so these pins are very, very important, and they are often asked in the examination. And whenever we talk about pins, the most common complication of sans pin, what is the most common complication of the sans pin? That is also often asked. Okay, so it is actually known as pin track infections. So what happens is, whenever you go for osteomyelitis, certain osteomyelitis can occur at the site of pin track, and that is known as pin track infections. There are different areas of different topic. Okay, so whenever you utter the word pin track infections, the next question will be, what is chronic osteomyelitis? What is acute osteomyelitis? How are you going to treat a case of chronic osteomyelitis, acute osteomyelitis? Okay, so actually I've talked about four important areas, which is four important structures which often we get confused with. One is a K wire. K wire is also used for close reduction and percutaneous fixation. Okay, for percutaneous fixation, K wire is used. Different areas like supracondylar fractures is also K wire is used. Okay, and next instrument I just talked about is the Steinman's pin, which is used in bone traction. I talked about Denham's pin, which is actually having corrugations in the middle, right? And then I talked about the sans pin or the sans screw, whatever you can say, sans pin. So the first instrument that I talked was our titanium elastic nailing system. Whenever we talk about the titanium elastic nailing system, we need to say that titanium has gained its popularity because, remember, after you go under a titanium surgery, like when you insert titanium, remember that it is very less corrosive. And the second surgery, if you don't want to do, that's also okay. But after putting a stainless steel, you have to go for a surgery. Okay, and this instrument we already talked, if it has corrugations at the last, once again I would like to say you, if it has corrugations at the last, that is your sans screw. Okay, that's your sans screw, sans pin. Okay, sans pin. Okay, and Steinman's pin and K wire, that also have this. These are the instrument which is very, very confusing. Denham's pin, corrugations at the middle. Sans pin, corrugations at the last. Steinman's pin, it's long and it has this cylindrical type, cylindrical type at the top. K wire, it's just a thin wire plate with nothing. Okay, K wire is just a thin wire plate. Okay, so that completes our major instrument, which we often get confused with. So if it has corrugations in the middle, it is Denham's pin, that is used in the case of osteoporotic bone for a stronger grip. That is important for us to understand. Okay, now the instrument that I'm picking up is actually a mallet or a hammer. So this is very easy instrument to identify. So this is also known as mallet or hammer. So this is used along with a osteotome and a chisel. Now again, I will show an osteotome and a chisel in the upcoming videos. Whenever we talk about these mallets, it's very important. So these mallets are also used in the ENTs. It's also used in the orthopedics. Okay, now I have now picked up plate. Now these plates, there are different plates. Okay, so about the plates also I would like to say. So plates, it is working under four principles. One is the bridging mode, other one is the neutralization mode, other one is compression mode, and other one is the buttress mode. So there are different kinds of plate. Okay, so this plate which I am holding now, which is actually, it is known as a it's a dynamic compression plate, but this is a semi-tubular dynamic compression plate. Okay, so if it has a gap, so if it's a simple plate with no gap, so you can see here in this instrument that you can feel the gap, right? You can feel that it's not a totally flat tube, it's like a tube, like, okay, so tubular type of plate. This is known as semi-tubular plate. Okay, this is known as semi-tubular plate. Now there is something which is known as limited contact locking compression plate also. What is the benefit of using LCP? That is basically the periosteal blood supply is maintained. Now in my hand I have dynamic compression plate. So what you need to say is this instrument is a dynamic compression plate which consists of how many holes are there. You just say the holes. Okay, and this DCP also can be of various type. One is narrow DCP, other one is broad DCP. Okay, so there are different types of DCP, dynamic compression plate. And what are these plates used in? Of course, these plates are used in the case of your fractures. Open reduction internal fixation with plates and screws. So these are the different methods by which we go for open reduction internal fixation by plate and screws for a better stabilization. And whenever we use plate and screws and you go for open reduction internal fixation, what you need to remember is the mobilization is early. Okay, so when the mobilization is early, what are the different things that we can prevent with? We can prevent with different kind of bed sores, different kind of pulmonary thromboembolism, because whenever someone is at rest or whenever someone is at stasis, they will have pulmonary thromboembolism or bed sores. Now the instrument that I'm holding is actually known as a recon plate or a recon plate. Okay, so these recon plates are actually used in areas like clavicular fractures. These recon plates are the plates which is actually, you can modulate these recon plates. So we can use in the case of clavicular fracture these recon plates. Okay, so there are different plates like dynamic compression plate, recon plate. Now this instrument which I am holding is known as a hook plate. This is also used in the case of clavicular fracture. Okay, this is also known as a hook plate. This is known as a hook plate. Okay, so there are different types of plate. Why do we use plate? Because the site is bypassed. Okay, the site is bypassed and the force is transmitted from one part to another part, bypassing the fracture site. Okay, now this which I am holding is known as a buttress plate. Now the word buttress means support, so it gives support to the metaphyseal region. So this is usually used in the case of tibial plateau fractures. Okay, it can be used in other fractures also, but one example is enough to understand. So tibial plateau fractures, it's used this buttress plate, and this buttress plate, hook plate, dynamic compression plate, limited contact locking compression plate, and then you have dynamic compression plate. Okay, semi-tubular plates. Okay, so these are the different plates that we have in our department. Now we come to some other instruments also. Okay, so you need to remember that there are four principles for plate. Okay, this is often asked: bridging mode, neutralization mode, compression mode, and buttress mode. Okay, bridging mode, neutralization mode, compression mode, and buttress mode. Okay, and DCP, as I already told you, it is broad DCP, narrow DCP, and smaller DCP. Now, this two instrument that you are seeing in front of me is actually known as a chisel and an osteotome. Now, what are these chisel and osteotome basically used for? So, we basically say khurkinu. In Nepali, it's known as khurkinu. Khurkinu means extra amount of bone which has been formed. Okay. So, basically, at the time of union, again, the component comes to non-union and malunion whenever you take this instrument. So malunion is actually a method by which there is no union. Okay, no union is known as malunion. But if there has been malunion is there is union, but there is union in an abnormal pattern is known as malunion. And non-union means radiologically by 3 months, and your clinically by 9 months. Okay, so painless and mobility of the joint is known as non-union. Okay, so this is your chisel. Okay, if it has like a slopy portion at the top, that is your chisel, and if it's not slopy at the top, that is osteotome. Okay, so you can see that there's different, like color is also like different. No, it's like from gray to silver. It has gone from gray to silver. That is actually your chisel. Now, if you look into osteotome, it's static. Okay, so it's same throughout. So that is your osteotome. Okay, one is chisel, other one is osteotome. It's very easy to identify chisel, osteotome, and mallet. Okay, so the next is actually your screwdriver. Okay, so again we come to the topic of screw. So whenever we talk about screw are different. There are different types of screws, like cannulated screw, cortical screw. Okay, or there is actually also known as lock-in screw, which used in the case of LCP. And this screw has a recess at the top, and in that recess we use screwdriver. Now, what is this? This is your stainless steel wire, and this is used in the case of total band wiring. Okay, in the case of TBW, in the case of patellar fractures. So patellar fractures, what are the different types of patellar fractures? Communicated fracture or transverse fracture, oblique fracture, right? So in the case of severely communicated patellar fracture, we have to go for patellectomy. And the only complication of patellectomy is lack of 10 degree of extension. So you are not able to go for a full extension. So 10 degree of extensor lag will be there after a patellectomy. That should also be into your mind. Okay, that can be asked. Now this instrument which is there in my hand is actually a manual drill machine, which is very easy to identify. Manual drill machine, that gun like instrument, and that is a key. Okay, that key you are able to keep in that manual drill machine. Okay, so that is a key. Please don't be confused with key and bone tap. Okay, so bone tap is slightly longer. Both looks like copper T. Both looks like copper T, like you have seen in the case of your family planning classes in your gynecology. Now what is this? This is actually your this is also a type of intramedullary nail, but this is absolute now. Okay, so this is absolute now. Exact name I forgot the name for this one. I'll be writing in the description box. But this nail is obsolete nowadays. Nowadays the nail that we are using is only the intramedullary interlocking nail. And one more question regarding nail, that is what fixation the nail is used. The nail is used in 3-point fixation. Okay, now what you can see here is the screw. Now for the screw you need to understand that there is cannulated screw, there is cortical screw. Okay, so whenever we talk about cannulated screw, this is the cannulated screw. Okay, this is the cannulated screw. And cortical screw means, the pitch is very, very small in the case of cortical screw. Now pitch is the area between these two threads. Okay, so between the two threads the distance is known as pitch, and that pitch is very less in the case of cortical screw. In the cancellous screw it's slightly larger. Okay, it's slightly more. Okay, and remember that whenever we talk about these what is the principle of the screw is very, very important. The principle of the screw is the screw converts torsional force into compression force. Okay, now this is very easy to identify. So this is known as Austin-Morris processes, which is used in the case of hip replacement. Okay, so it's used in the case of hip replacement, in the case of fractured neck of femur. As soon as we utter the word fractured neck of femur, we should understand about the Powell's classification. guidance classification, right? And age-wise treatment of fractured neck of femur. And fractured neck of femur, there is high chances of going on a non-union because of the blood supply. Now, this is simply a K-wire cutter. Okay, K-wire cutter. So this, you can just say a wire cutter. Okay, wire cutter. Now that instrument in my hand is actually known as AWL. Okay, AWL. Okay, so this AWL is also used in the case of entry in the bone, and this, along with this AWL, there is also something which is known as a drill bit. Okay, drill bit. Now drill bit is also so confusing with Steinman's pin and sand screw. Okay, so whenever you see drill bit, see the corrugations in the drill bit and see the corrugations in your sand screw. Okay, the sand spin. Now this sand spin corrugations are so well demarcated type of corrugations. Okay, well prominent type of corrugation, and this corrugations which is seen in the case of drill bit, there are actually very shiny type. So that is TENS, which I was just touching. Okay, titanium elastic nailing system. The instrument that I am touching next is the K-wire. Okay, and this instrument which I am now picking up and comparing, this is your, okay, you can see that the sand spin and the Denhens and the drill bit. So drill bit and the sand spin, very very confusing instrument. So the above one is the drill bit and the lower one is your sand spin. Okay, drill bit and sand spin. So it's these instruments are very very confusing, so please mark up. Okay, now next that you need to understand whenever we talk about these drill bit is that drill bit is used to make pilot hole. Okay, so the first hole that is made inside to insert the screw. Okay, to insert the screw is known as a pilot hole, and that pilot hole is actually made by the drill bit. Okay, so this instrument which is in my hand is what is this? This is a Steinman's pin. Okay, Steinman's pin, which is used in the case of, yes, it's used in the case of bone traction. Okay, so I'm taking a lot of time. It's better you watch this video in 2x speed, but I'm just giving the difference also and the questions also. Now whenever we talk about certain drill bit, or whenever we talk about inserting an intramedullary interlocking nailing system, the question that comes to you is, what is the complication? Like if you insert, what is the complication? Most important complication is the fat embolism syndrome. Okay, or acute respiratory distress syndrome. This also happens in the case of your fracture of the pelvis. Okay, or it's long bone fractures. Okay, so there's also another instrument which I just held, that was a dynamic hip screw, which has a plate and the movable screw. Okay, which just I left over there, dynamic hip screw. Now this instrument is actually known as a Ross nail. Okay, Ross nail. It looks like umbrella of Popat Lal, and the above umbrella and the above that curved portion is used to take that nail out. Okay, that is known as a Ross nail. Okay, Ross nail, very very easy to identify. Ross nail again, whenever we talk about nail, first generation, second generation and third generation. Okay, and there is one Kushner's nail. So Kushner's nail, if you look into the tip, it looks like a clover. Okay, it's known as a Kushner's nail, and that Kushner's nail is actually a first generation nail. It will come in the upcoming videos also. Now this is known as a intramedullary interlocking nail. Now this is a femur intramedullary interlocking nail, but there is also other type of nails also, which is basically the tibial intermedullary interlocking nail. As I already told you, the most common complication is dyspnea. Remember, dyspnea, I told you dyspnea, it's the fat embolism syndrome that is presented with dyspnea, tachycardia, right? And whenever you look into the lower palpebral conjunctiva, you'll see certain petechial hemorrhages. You can look at the chest, you'll see certain petechial hemorrhages. Okay. Now comes this instrument. So this is a Lohmann's clamp, and this Lohmann's clamp is actually used to fix the plates. Okay, so this is known as Lohmann's clamp. Okay, so the next instrument that we are going to discuss is Okay, so this is actually known as the tibial intermedullary interlocking nail, and the angle that is made over there is known as a orthox angle, which is about 11 to 15 degrees. Okay, and that angle and the above one two holes area, one is a static hole, other one is a dynamic hole. Okay, now this is actually known as a universal clamp, and that is known as a connecting rod. This universal clamp, connecting rod, and the sans pin is actually used in the case of external fixator. So what is external fixator? Again, I have told you, whenever we talk about out of the word external fixator, next question comes, what is external fixator and where do you use it, and what is open fracture? Gostler-Anderson classification must be very much clear, okay, whenever it comes to external fixation. And usually tibial fractures, there's high chances of open fractures in the tibia. That's why we have to understand about the open fracture treatment. Gostler-Anderson's classification is very, very important. Okay, and this is the universal clamp. And the last instrument which we are going to pick up is known as JES, Jos's external stabilizing system. Okay, the last instrument. Okay, it's coming. The instrument is yes. So this is JES. Okay, Jos's external stabilizing system. So this consists all the instruments in the orthopedics. Okay, and some leftover instrument we'll be talking in the next video. So this consists all the instruments of orthopedics, and remember the instruments, it goes, the viva goes on like the instruments that you pick up. For example, if you pick up an osteotome, it might go towards malunion or non-union. If you pick up a buttress plate, it might go towards a tibial fracture. If you pick up a hook plate, clavicle fracture, or it depends upon what you pick. You pick K wire, you might be asked about supracondylar fracture. Okay, thank you, subscribe and like.